Around the world, millions of people are battling a silent killer, hepatitis B. This disease is caused by a virus that leads to liver cancer and is fatal in 1 out of 3 carriers. Infection rates in Asian Americans have risen to a crisis level, and in the United States it is now the #1 killer of Vietnamese men between 25 and 35 years old.
The prevalence and the incidence rates of hepatitis B infection in our community is just tremendously high compared to the mainstream population. There's roughly about 1.3 million hepatitis B patients across the country in the United States, and over 50% of them are of Asian descent.
The disease is generally spread through unsafe sex, blood transfusion, and during pregnancy from mother to child. And yet as the infection rates increase, awareness in the Asian American community remains extremely low.
No, I have not been vaccinated for it. Doesn't Pamela Anderson have hepatitis B? No? Okay, guess not. I know nothing about it then.
I had no idea that hepatitis B was the #1 killer in Asian American males. Whoa. No, I had no idea.
It's kind of shocking that I'm an Asian American and that I don't know anything about this at all.
It'd be good to know what it is, how you contract it, and what I can do to prevent that, especially if I'm at a higher risk age group and ethnicity.
2 years ago, a diverse group of Asian American healthcare professionals in New York City came together to form the Vietnamese Health Initiative, focusing on raising awareness of this disease.
It's about the education and vaccination, but it's also really about making systemic change of really prioritizing hepatitis B as a public health problem, particularly in this community.
The Vietnamese Health Initiative is not alone in their efforts. Organizations such as Affinity Health have tried to make healthcare and education more available with mobile clinics in Chinatown and Flushing. But across the board, Asian American medical outreach has been stalled by lack of government funding.
Asian Pacific Americans make up 12% of New York City, which is a huge percentage. The amount of social services that get channeled into the Asian Pacific American community is less than 1%. Less than 1% of public dollars is channeled into the community. There's a huge disparity.
Without representative funding, there isn't enough money going into outreach programs within the Asian American community to screen and vaccinate people at risk.
Around your arm, oh, you have big chunky veins. Detection leads to early treatment, and it's just incredibly foolish not to get screened because it's a simple blood test if it can save your life and save the lives of others around you.
With unknowing carriers spreading the disease, education and screening continue to be the top priority in combating hepatitis B. To get screened or vaccinated, go online to www.liverfoundation.org for information on the clinic nearest to you. This is Merritt Gurley reporting for NYU Tonight.